Almost every American is concerned about the increasing cost of health care. Debates continue on how to control these costs without compromising patient care.
Because of my 30 years of work on quality improvement, I know that the best way to reduce cost is to improve quality, not to cut back on care.
Dr. Donald Berwick is the former administrator of the Centers for Medicare and Medicaid Services and also the former president and CEO of the Institute for Healthcare Improvement. He says waste is the #1 culprit in healthcare.
If we don't work on waste and improvement of care as the fundamental agenda for reduction of cost, we're headed over a cliff. Bad things are going to happen.
In a special communication published online first and then in this week's issue of JAMA, Journal of the American Medical Association, Dr. Berwick and his co-author Andrew Heckbarth have 6 suggestions for cutting waste. 1. Failure of healthcare delivery.
This is when care goes wrong, when we have a postoperative complication that could have been avoided, or an infection that someone gets, or a medication mishap.
2. When that care isn't coordinated.
So we drop the ball when you go from a primary care doctor to a specialist or from hospital to home.
3. Overtreatment. Receiving drugs, devices, or interventions that may not help.
For example, getting antibiotics for a viral infection doesn't do any good at all, and yet we do it all the time.
4. Dealing with complex administrative rules and forms.
Lots of different players in healthcare add costs by requiring you to jump through hoops if you're a doctor or a nurse, filling out forms and things like that don't add any value.
5. Pricing failures. In the U.S., diagnostic procedures such as MRI or CT scans cost several times more than identical procedures in other countries. And 6. Stopping system fraud and abuse.
Doctors and nurses and pharmacists have a natural partnership with patients around that very question. Does this help? Because if it doesn't help, we need to stop it so we have the money available to do what does help.
Catherine Dolf, the JAMA Report.